Thanks so much for being back on the show.
Absolutely. It's always my pleasure.
Of course. Now, when people are experiencing back pain, and I know that's such a common thing, what about the lower back? What exactly is going on when that hurts?
That's a great question.
Yeah.
And really the second most biggest symptom that comes into our office is lower back pain. Of course, we focus a little bit more on the neck and the headaches, but we do see a lot of back pain patients. The spine is made up of 24 movable bones, okay? In between each two of those bones is a disc. And then also there's nerves that come out on either side. Plus there's a couple of joints in the back part called the facet joints. They're like the strut things on your car, the strut joints on your car. Well, what can happen in this lower back is a lot of people think that it all just comes from discs. Oh, I've got a disc herniation or I've got a disc bulge. And it really can, but that's so one or two dimensional, and this body is a three-dimensional organism. So there's so many things that can cause that lower back pain. We can have bulging discs. We can have what's called a disc herniation, where the disc has just kind of blown out and putting pressure on a nerve that causes pain. But the biggest symptom with that type of thing is pain that goes down into a leg, if it's in the lower back, or if it's in the neck, it goes down in the arm. So if it's in the lower back, it most commonly will go down the leg. But the most common symptom is just lower back pain. Most of the time, that's due to some type of a mechanical problem down there. The facet joints that I talked about, they kind of overlap, and actually they're right on this spine right up in here. And these areas right in here. And what will happen is when these joints get kind of tilted or twisted, they can jam those joints up in the back, and they're very pain sensitive. So they'll cause pain just in the lower back. One of the primary things that you go see a neurologist or a neurosurgeon for is the disc problem, but it goes down into the leg. They kind of refer to other type of professionals just for lower back pain, because if they do surgery in there, unfortunately, a lot of the research shows that surgery on just back pain doesn't work that well. And they'd all agree with me on that, so I'm not saying something that they wouldn't agree with me on. But according to the National Healthcare, and I can't remember the exact society that did this, but they said that chiropractic manipulation is one of the best things for mechanical lower back pain. And so that's what we do.
Now, for those who are experiencing that pain and looking for solutions, how can we get in touch with you guys?
They can contact us by going to our website or by just calling us on the phone.
Perfect. Thank you so much for being here.
Sure, it's my pleasure.